Hello, this is Module 5, HIV and Hepatitis C Risk Reduction Counseling for the Qualified Professional Test Counselor Certification course. This is Bobby Ducharme, Community Outreach Director of the Rhode Island STD Clinic. We're going to be talking about counseling skills and techniques. Well, if you're listening to this, you're very interested in learning about what makes a good counselor. And that's what we're going to talk about here. So there's some general skills that any good counselor needs. Things like listening carefully to somebody as they speak, and really learning how to listen between the lines. I mean, because people talk and sometimes don't really say exactly what they mean to say, because there are many issues always going on with someone. So it's learning about how to be with somebody where they're at, really, and then using your skills as a counselor to draw them out so that you can really get at what the issues are underneath what they may be saying at first. So these are some of the skills we use, are listening actively, empathizing, using open-ended questions and probing from the open-ended questions, focusing them, so really getting them to shift a little bit in the way that they are responding. And also, if there's anything that they're saying that really is not accurate, we want to really make sure that they understand that where their mistake is. Of course, one of the most important things in working with others, I think, is being respectful and non-judgmental. So you'd be surprised in so many ways that we react in a judgmental manner. And it comes across in body language, it comes across in the words we use. So one of the things you really want to concentrate on is being respectful and not letting your own judgments cloud what you are talking to the person about. So in that way, you can really talk about what they need. And that's what we're here for. We're here to meet the client and talk about what they need, and then get them the appropriate testing and referrals. Because that's the other thing. The role of the testing counselor is limited, and so at some point we will want to refer to additional services if needed, and make sure we've talked about everything that the client needs. So prevention counseling, because here you are working in HIV prevention and hepatitis C prevention, is client-centered. And that means that you're always going to come back to ask them and discuss with them what it is that they want, need, and feel. One of the other things we want to do in the counseling session is talk about risk. And we'll talk a lot more about that later. And risk, of course, is dependent on a lot of issues. And then we want them to leave with an action plan of some sort, just even if it's very, very small, like test again. But if they have something that they can do, it definitely helps. So techniques for prevention counseling. So asking open-ended questions. These are questions that cannot be answered with yes or no. So in essence, we want to have a conversation with people. We don't want it to be a list of things that you're going to be looking for, which you are when you are doing this work. You do want to get some information, some basic information about their sexual habits and their sexual partners and all that kind of stuff. But we want to do it in a way that's more conversational. So using open-ended questions definitely helps. And so these are questions that cannot be answered with yes or no, and it encourages the conversation. And then attending them, I talked about this before, with verbal and nonverbal cues. So sometimes just listening attentively and looking at them in the eyes and shaking, nodding the head yes, allows them to see that you are interested in what they're saying and you are right there with them. And that's the most important thing. The third technique is offering options. So, if you have somebody who's at very high risk, just how you're going to reduce that risk slightly, or reduce that risk in a way that they can actually do. So you're going to give them several options in order to do that. And then also simplifying everything that you say, because using medical terms that they might not understand is not really the best way to communicate with someone. So here's a sample about an open-ended question. So, how do you feel about an HIV test today? Gets the client talking. If you said, do you want an HIV test today? Well, they can only say yes or no. So definitely you see how that works. So in this counseling session, you have several things that you're going to be doing. The first thing is to greet them and establish some kind of rapport. So getting that opening discussion going sometimes can be challenging. So we always ask the client what brings them in. We talk about how everything that they say will be confidential, and if they have any immediate concerns or issues. So here are some sample questions. What brings you in today? You're here for an HIV test. Do you have any questions or concerns? When was your last HIV test and what was the result? Do you consider yourself at risk for HIV? And how are you feeling today about testing for HIV? These are just samples. You probably can think of many more. So some of the things you really want to focus on in that first few moments, if they have any questions, and if they need to understand what the difference is between HIV and AIDS. Some people think that AIDS and HIV are the same thing. So you might need to just explain that medical terminology that AIDS is and that HIV is the virus. You might need to review how HIV is transmitted and how to prevent it. A lot of people come in, they already know this because they've been tested many times. They've talked to many counselors, but some people are new and might need to know this. You might need to talk about how the rapid test works, and definitely you will want to explain that if the rapid test is positive or reactive, there will be a need for confirmatory testing. And then if they ever say anything during the session that is totally off base, you definitely want to take a moment to clear out the misconception or myth that they may be believing. And as a result of this discussion, you will determine if they are ready for testing, and you can always ask, so are you ready for the HIV test? You'll explain how the test will be performed, which I believe Dr. Channing already explained in another section. You'll get a verbal consent from them that they do want to test, and they can always opt out. And some people like to forecast the outcome of testing by talking to them about positive or negative results and how they might feel. Now to the meat of the matter, risk reduction counseling. So in this discussion, you'll be talking about their risk behaviors and the circumstances that bring them to risky behavior. So it's the people that they're having sex with, their community of sex partners, if there is one. And so what you want to do, of course, as you determine, and you will learn this a little later, how to do this a little better, once you understand their risk, then you can actually find out the one or two things that you might suggest as a way to reduce the risk. So these are identifying those safer goal behaviors. You'll be reducing risk. And then that's when you develop that action plan and you make referrals and provide support. So we're going to go through each one of these sections here in further detail now. So the first thing to think about is talking about sex. So ask yourself, are you comfortable talking about sex? Because that's one of the most important things that you'll need, is an ease and comfortability in talking about all kinds of sex, even things that you may not do or understand. And this, How to Take a Sexual History, is actually from the CDC, and it talks about educating physicians about how to take a sexual histories. And there are 5 P's, they say. The first is talking about partners, finding out how many partners they have and the type of partners they have. The second is determining the types of sexual practices that might put them at risk. So this is actually what they are doing. Are they having anal sex, oral sex only, vaginal sex, anal, whatever. What else? And then the third P is, do they protect themselves from STDs? So what do they do? Are they using condoms? Do they do anything else to protect themselves? And the fourth is, do they have any past history of STDs? So that's very important information to know, because if they have a past history of STDs, they've probably been treated, so they've already been through that gamut, and there is more of a chance that they'll continue to get STDs if they've had a past history. And then if they're female, talking about prevention of pregnancy, what are they doing? And there are some links here to go right to the CDC to a really lovely brochure and more information about these 5 Ps if you're interested. So in terms of taking the sexual history, just don't make any assumptions about sexual and or gender orientation. So this is very important, because people come in many different stripes, and if they are presenting as a female and want to be called a female, please call them a female. And as a result, maybe you could use gender-neutral language. So instead of saying, do you have a wife, or do you have a husband, do you have a significant partner? And you want to really focus on their behavior, not on their orientation. People may do things in the privacy of their bedrooms that they don't want to talk about in this room. And so what you want to try and get to is what actually they are doing in that privacy of their own bedroom. And sexual orientation and gender are also on a large continuum. So you need to understand that and then be fluid with how you respond to them and who they are. And really observe yourself. So your languaging and your body language, both your spoken language and your body language really tells people a lot. So just beware of what you are doing and how what you are indicating to them by what you're saying and how you are reacting in your body. And if you use a term or make an assumption that might offend these people, your client, just apologize and say, I'm sorry, I made an assumption and move on. But simple apology is all that is needed. So number one, identifying the client's personal risk behaviors and circumstances, a sexual risk assessment. So there are a number of things you'll talk about. When was their last HIV, hepatitis C test? The number and type of sex partners in the last time period that you're evaluating. It could be since their last test. It could be in the last 3 to 6 months or the last year. How often do they use condoms? What percent of the time is a better question than saying, do you use condoms? Because that's, again, that puts them in the yes and no thing. And sometimes they'll say yes when they mean no. And then the types of sex that they're having. Are you having vaginal sex, oral sex, anal sex? If they're having anal sex, try and determine, are they mostly a receptive or insertive partner, a bottom or a top? And of course, if they are mostly receptive bottom, then you might take that opportunity to remind them that, that does have the highest risk for HIV acquisition. And then, do they talk to sex partners about status before they have sex? Now, that's a really difficult question because most people say, well, it's, I don't really talk to people about that because, why should I? Especially in the heat of the moment. It's like condom use. Most people say, I don't use them because it's the heat of the moment. But you'd be surprised how many people actually do ask those questions in advance. So here we are. Here's some sample questions for you in a way to ease the conversation. I'm going to ask you a few questions about your sexual health and practices. These questions are personal, but they're important for us to understand your overall health. So do you have sex with men, women, or both? What percentage of the time do you use condoms? Why or why not? That gets the conversation going. And how many partners have you had? And how many partners are known to be HIV positive or of unknown status? So 2, identifying safer goal behaviors and sexual risk. So here's some ideas of potentialities for that action plan. So getting tested frequently. So if this is a person who has frequent high-risk sex, we want to talk to them about getting tested at least once a year, more likely every 3 to 6 months, depending upon their risk. Are they testing for other STDs? Are they getting other STDs? Well, that increases their risk of HIV. So perhaps testing more regularly for STDs in addition to HIV. Considering condoms. Considering reducing the number of sexual partners. So if they have 30 or 50, well, can they come down to 20? And then determining and knowing and learning about the status of their partners. Then there is the option for pre- and post-exposure prophylaxis, PrEP and PEP. So this is another option that you can give them as part of a plan. So if they had a very recent high-risk exposure in the last day or 2, you can offer them PEP, post-exposure prophylaxis. If it's beyond 3 days, it's too late, and then there might be a good discussion about PrEP. Considering oral or insertive anal sex rather than receptive anal sex, and making sure that they use water-based or other appropriate lubricant with sex with condoms, because that if they use the wrong lube, then the condoms can break. And considering abstinence or monogamy. It might be just the thing that somebody needs to hear. Um, the important thing is not to be judgmental or preachy when you're talking about all of these things. So, you could always couch it in statements like, some people are able to use condoms consistently. Why do you think that is? Or, and have a discussion about it. And then identifying safer goals behavior around substance use. So drug and alcohol use do affect decision making, and that can impact the way HIV risk happens. So maybe if they are using, talking to them about what they can do about it. So the types of drug use that you want to find out about are they using injection drugs? Are they snorting drugs? Are they drinking a lot? And all these things can increase the risk of HIV and hepatitis C and STD transmission. And then you may mention some prevention techniques for drug use about not sharing any injection equipment if they're injecting drugs. If they're snorting drugs, don't share the straws or dollar bills. Using new syringes every time, and getting them from the local syringe exchange. And for alcohol use, it would be limiting the number of drinks before engaging in sex. And then, once you have all this information, you would develop that action plan that I've talked about before. So it would have an interval for the next HIV test, which, depending upon risk, could be 3, 6 months, or even a year, if they're very low risk. Other STD testing if needed, offering free condoms if available, which they should be. The state of Rhode Island does have a condom distribution program, and you can get them if you want. They should be definitely available in your site. Discussing any gaps that might have been identified about what they're thinking about, and then summarize the risk and any change that they're going to make. And that's your plan, the goal. So delivering results. So there were 3 positive outcomes for the rapid HIV test. Non-reactive, which is negative, reactive, which is positive, and invalid, which is neither reactive or non-reactive. People do not really understand reactive or non-reactive too well, so that's why we tend to say negative or positive, but know that the technical result is reactive or non-reactive. So for a negative result, you want your body language and your voice and your face to be totally neutral when you deliver the result. This goes for positive or negative test results, because that way the client can't see what the result is going to be. And then you explain the test result simply. Your HIV antibody test result today is non-reactive or negative. And then if they had any recent risk exposure within the last 3 months, you need to speak to them about the window period, make sure they understand this 3-month window, and the need to retest. Now, there is always another option, which is to get the 4th generation test, which is a blood test. And you could offer them that if they're nervous or concerned about the 3-month window. And that reduces the window to 2 weeks to a month and a half, essentially. To continue the negative result, you would refer to any additional testing that may be required, so any STD testing, anything else. Make sure they understand what this test result is and what the limitations of it are. Review your risk reduction action plan which you discussed with them while the test was running, and provide further information, counseling, condoms relevant to their needs. So whatever they need, you give it to them. Post-test counseling, positive results. So, I just want to say something before I even delve into this. So, giving a positive result, especially if it's your first time, is a challenging situation. You will see that second line on that rapid test, and you might have a visceral reaction in your own body. So the important thing is that you need to get ready to give this test result. And if possible, bring somebody in with you so that you're not giving that result alone. And if you have anybody, another counselor, a doctor, a social worker, anyone who might be available to sit there with you, because anything could happen and you want to be ready. But you have to handle yourself first, and then you go in and meet the client. Hopefully you have a friend, coworker with you. So again, you deliver the result simply, and you have that neutral face first. So, either test result, neutral face and body language. And then you deliver the result and say, it is a preliminary, reactive, or positive result, and it does require confirmatory testing. And then you give them time to just think about getting that result. You're going to see a reaction, and you let them process for a minute. And then you would talk about the need for the confirmatory testing again, and if possible, make that appointment. And if they don't want to talk, or if they don't want to do anything else, you have to respect their desires and just, hopefully they will want to know what is next. Most people do. They're like, what do I do? What do I do next? So confirmatory test would be the first. Make that appointment if you can, so that they leave with an appointment. Make sure they have information about mental health services or any other support services. Talk to them about questions they might have about living with HIV, how it works, how it's transmitted, how the treatment works. And if you don't know any answers to questions that they have, just say, I don't know, and I will get back to you, and make sure you do get back to them. And of course, I guess the most important thing is that even if the test is confirmed, life expectancy is normal for someone with HIV who takes medication. Very important for them to understand that this is not the HIV of 10 years ago, or even 5 years ago. I mean, people are living healthfully with HIV. And as long as you have a caring, non-judgmental attitude through this whole discussion, the client will be fine. And hopefully you will leave them with a plan. And then the fourth step of the whole testing counseling session is to make referrals in closed sessions. So depending upon the result, of course, will be a different set of referrals and closing session discussion. So if it's negative, of course, you can refer them to other services if appropriate, PrEP or PEP, substance use treatment, mental health services, domestic violence services. If it's positive, it would probably be substance use treatment, mental health, domestic violence. Then see if you can confirm that there are no other questions or any other niggling ideas in the client's head, and then restate their risk reduction plan. So we agreed that you're going to try to reduce the number of sex partners by 1 or 2, and We're going to try to use condoms with every other one or something like that. Just whatever simple plan you made. And sometimes just testing again is an action plan that works for a lot of people, and that is okay. So that is very important to remember. Of course, as I've said many times, the most important way to be in this counseling session is non-judgmental and supportive. And then here are some characteristics of good counselors. Little thoughts and tidbits to leave you with. So you want to treat your clients with respect. You want to be sensitive to everything they say, and be sensitive even to everything they don't say, but you see in their body language. You want to notice what that body language is telling you, and then respond to it in an appropriate way. You want to be very aware of cultural and psychological factors that affect the client, so you can leave your judgments outside that room and be kind, courteous, considerate. You want to use language that the client understands, and you really want to encourage them to engage in a conversation with you so that they feel comfortable asking you anything they need. You'll be listening actively to any of their concerns and responding accordingly. And then you'll recognize when you need to refer them to others for additional support. For the role of a testing counselor is limited, but what you do is essential to the health of each client you encounter. Thank you very much. If you have any questions or concerns, feel free to call me, email me. I'm here to help.